So if we look at the structure of muscles and muscle fibres, we break it down into a microscopic level. We start with bundles of muscle fibres. So if you look at a batch of muscle fibres, and then you've got what's creating those muscle fibres, even smaller levels of muscle fibre, and then to create one muscle fibre, you have myofilaments. Within those myofilaments, you'll have actin and myosin, and they're the proteins that allow contraction. So myosin and actin work together through a sarcomere that contract and pull apart, that creates that lengthening and shortening of a muscle. Within our muscles, within our bodies, we have different types of muscles. We have voluntary, involuntary, and cardiac. So voluntary muscles are those that are skeletal, that allow contractions. And if I think about moving my bicep, I'm going to move my bicep to create that flexion extension. Involuntary are usually smooth muscles that are within our digestive system and our organs, like the digestive tract and the intestines, that are going to contract and move ingested food down the tract to then get to a certain point. And then we have our cardiac muscle tissue, which is actually involuntary in itself. You don't think about doing it. And that cardiac muscle is your heart. It's a muscle, but also it's an organ. So it can increase in size through cardiac hypertrophy, just as your muscles do, depending on the physical stimuli that you create for it. So what we're going to look at now is muscle attachments. So like our bones, they attach to bone. Our muscles will attach to bone through tendons. So if we take the bicep, for instance, it's going to have an origin and insertion point. The origin is where it originates and where it starts. And that is through the scapula at the back, which is the coracoid process of the scapula, is the location of it. Its insertion point is what it is pulling. Okay, so what the bicep is pulling is the radial tuberosity. So if we break that word down, radial tuberosity, it's the tubular part, so the long part of our radius within our ulna. So it's going to pull and contract to bring that together. That tendon connects to the bone through a muscle fascia, which is directly attached to the tendon and then attached to another muscle fascia to the muscle. If we look through muscle contractions, the general rules around it is muscles pull. Okay, so when I contract my bicep, it's going to pull my forearm closer to it. Muscles cross at least one joint as well. So each muscle will have one joint at least that it's going to pull towards itself to allow that movement. As well as that, muscles contract and use loads of different fibres. So if we think about one muscle, to do one action, it's not going to recruit all the muscle fibres within it to do that action. Your body is quite efficient. It's going to recruit the number of muscle fibres that it thinks it's needing. So if you increase the stimuli or the weight or the load, then it's going to feel that it's going to need more muscle fibres recruited to do that action. And again, muscles are antagonistic pairs. They work together. With one action, there is an ultimate reaction. So with the flexion and contraction of my bicep, there is relaxation and extension of my tricep. The different types of contractions that we look for within muscles are concentric and eccentric, that we've covered quite a little bit through doing movements and range of movements within joints. But concentric movement is that movement where it shortens, that muscle gets shorter, that is allowing the range of movement to come closer to your body usually. And then eccentric is ultimately the opposite to that, which is the lengthening of that muscle against gravity. And then our last one is isometric, which is the contraction of a muscle, but it's not moving. So an isometric hold would be a wall sit where our quadriceps and hamstrings are in a contracted position, engaging to allow our body not to move, but they're still recruiting muscle fibres continually to allow the movement not to happen. If we look through muscle fibres and the types that we have type 1, type 2B and type 2A. So type 1 muscle fibres are slow oxidizing fibres that are going to use oxygen and glycogen to support movement. So it's going to really be used for long bouts of exercise, running. So what you'll find is in the body, when we adapt, depending on the exercise that we do and the activity that we do, our body will slowly change the muscle fibre types that we have to best respond to that stimuli that we do. And every individual muscle that we have will have a combination of all of them. It's not going to be made up of all singular type 2 muscle fibres to use powerful, quick movements. It's going to have a multiple of all of them. Okay, so type 1, they're red in colour, contains a large number of mitochondria to allow that oxidation through it. Type 2b, fast glycolytic fibres. So we're using glycogen, we're using usually anaerobic glycogen, which is stored in that muscle to contract and use as an energy source. White in colour, contains low number of mitochondria because usually we're not using oxygen. Like I said, it's anaerobic. And usually used for strength or anaerobic type of activities like sprinting for a short distance of time, depending on what energy system is used to then resynthesize the ATP used. And last is type 2A, is fast oxidative glycolytic. It's pink in colour, so what it's meaning is it's using aerobic glycolysis, so it's almost in the middle. It's going to use oxygen and glycogen to incorporate those muscle fibres to be recruited. Large amount of mitochondria, but a lot more than type 2b, less than type 1. Okay, so looking through our muscle fibres, when we recruit them to engage against the stimuli, what we're actually doing within the anatomical parts of our body is the nervous system is controlling the muscular contractions themselves. So what happens is your brain sends signals down your CNS, which is your central nervous system, towards those muscle fibres, the motor units, which is controlling the connection between your nerves and your muscle fibres. What that does is then tells those muscle fibres to then contract. So if we look at those motor units and how important they can be, is if we take a CrossFit athlete. A CrossFit athlete can usually lift a lot of load for a certain amount of repetitions. Now they're not going to be huge in size in terms of muscular size, but what they've trained is they've trained the amount of motor units that they have in their body to then contract the muscle fibres. So they're basically more efficient at contracting those fibres and recruiting more fibres through having more motor units. What this is called is the all or none law. So all of the fibres in that motor will be recruited. So the more motor units you have, the more muscle fibres will be recruited. What we're going to do now is we're going to go through each individual muscle and break down its insertion and origin point and how it moves to allocate different exercises for us to incorporate for our clients and people within the realms of personal trainers and fitness. So if we look at the anatomical terms that we're going to use here, we're going to use origins and insertion points. So we're going to learn the names of those muscles, where they attach to and what they move themselves. What I want you to think about is those antagonistic pairs again. So think about how they move together. What we think about is the origin is usually nearer the midline of the body or superior. The insertion point is usually further away than the midline of the body to allow that movement to come closer or almost adducting. So yet again, we look at which way we look at the body. We have an anterior view, which is our front view, and then we have a posterior view, which is the back facing side of me. Okay, so if you look at the bicep, so with the wording of it, we look at that and break that down anatomically. So it's one muscle, but it's got two heads. Okay, those two heads originate at a different place. So one of them is going to originate through the scapula at the coracoid process, and the other head, so the long head, is going to then originate further back through the scapula. The insertion point is that radial tuberosity in the radius within your forearm, and it runs across the elbow as a joint, which is a hinge joint. It's going to allow flexion extension at the elbow. A different exercise that you could use is bicep curls, hammer curls, or any form of curl that allows you to go through that range of movement. The next one is its agonistic pair, which is the tricep. Tri meaning three, so it's one muscle but it's got three heads, and they originate at different places. So if we look at the anatomy of the tricep, its origin is going to be the scapula and humerus. So the scapula is the flat bone at the back, and the humerus being your humerus within the top part of your arm. The insertion point is going to be your ulna, which is the opposite to your bicep. So there's two bones within your forearm, your radius and your ulna, which both are linked and inserted within two different muscles, which is your anterior and posterior side. Additionally, it adds to that flexion and extension, but it's the main recruited muscle for extension of your elbow. Your brachialis is within that region of your bicep, but it's a different muscle altogether. It works hand in hand at the same movement of a bicep curl, but what you're going to do is if you rotate your forearm, it allows recruitment of the brachialis. So what we think about is if I do a bicep curl, it's going to recruit the muscle fibres within my bicep, so the two heads. But then if I rotate my forearm, so the fist is towards me, it's going to recruit my brachialis even more. So the brachialis, if we look at anatomically, is the one that creates the higher peak within that bicep. It originates through your humerus, so it attaches halfway down the bone, and its insertion is the ulna. So it's going to be recruited for that movement of rotation as well as contracting the flexion within that muscle. Our deltoid is what we have in our shoulder. So our deltoid is broken up into three heads. It's got your anterior, your lateral and your posterior, named because where they're placed in the body, anterior being the front, lateral being along my side, and posterior being at the back. It originates at the clavicle and scapula, so it's going to have different insertion points depending on the head, but usually the clavicle at the end and then the scapula at the back, where you'll be able to feel it yourself. The insertion point is that humerus, because if you think about the movement it makes, doing a lateral raise is my deltoid shortening to cause that abduction away from my body, and then adduction adding into my body. Okay, so the next muscle is our Latissimus Dorsi, which is in our posterior part of our frame. It originates at the lumbar and sacral spine. So if you think cervical, thoracic, lumbar, so it's the mid part of our back and runs all the way down to the top part of our sacral vertebrae. Okay, its insertion point is the humerus up the arm. So if we think about it being our wings, that's where it gets its nickname. It's attached to our arms, almost like a bat would do if it had the wings to fly. It crosses our shoulders as a joint cross, so it allows that contraction. The joint action that it allows when it contracts is adduction, extends and then inwardly rotates to allow our shoulders to do that retraction and protraction. Our pectoralis major and minor work together. So our major is the major muscle which sits in front, and our pectoralis minor sits within internally underneath that muscle, and it's used as a stabilizing muscle depending on what it's used for and the load and the stimulus you put your body through. So if we think about the pectoralis major, it's going to originate through the clavicle and the sternum. So if we think about the sternum running through the center of our chest and the clavicle running laterally along our chest, it's going to attach both at these points as almost an upside down L. And what that does, the muscle fibers are going to run along our chest and contract our humerus. So its insertion point is the upper tubal part of our humerus. And what that does is if I do a dumbbell fly and contract my arm, adducting it towards the midline of my body, it's going to cause a contraction because I'm shortening that muscle. So a trapezius is the upper section of our back. It's got a lot of origin points from our C7 spine all the way down through our thoracic vertebrae. Its insertion point is the clavicle, which is the innermost part of the clavicle, so it runs internally, and scapula in terms of the backs of our shoulders. What that does is allowing contraction through a shrug, or if we think about a row, an upper row, bringing our shoulders and retracting our shoulder blades, our trapezius is doing that movement. The rhomboids, which sits underneath our trapezius, is originated from our spinous process within our cervical and thoracic vertebrae. So it's almost like a sheath of muscle that allows that retraction even more. Its insertion point is the medial border of your scapula. So if you think about your scapula being a triangle, it's going to be the most inner part of our scapula that is going to actually be attached to in terms of its insertion point, because it allows that retraction. Thinking about the movement it allows. The rhomboid is then the most further back part to our pecs, so that makes our pectoralis major and our rhomboids antagonistic pairs that work together, doing both retraction and protraction together. Now if we look further down our anatomy, we have our transverse abdominis. Now our transverse abdominis run down the sides internally. So what we have is we have our obliques, our rectus abdominis, and our transverse abdominis. Our transverse abdominis runs at the highest point, originating from our iliac crest, which is down here, our lumbar fascia, which is all the way through here, and our cartilage of our sixth rib, which is the lowest rib that forms down here. And what that does is it's allowing that rotation and compresses our midline within. So if you think about the anatomy of that midsection or trunk, if you can train those transverse abdominis to be withstanding of a lot of rotation, then it's going to be a lot slimmer. And what you'll get if you get deep volume within those muscles, you can actually get a thicker waistline. Our next muscle that we've just talked about is our rectus abdominis. Now our rectus abdominis originates in our pubis. So internally, it's going to go through my pelvis and attach and originate through the innermost point of my pubis, and then it's going to run all the way across my midline up to my ribs. And what it's broken down is sections of muscle that is broken up with cartilage within them. And what that does is going to allow flexion of the thoracic spine and the lumbar. So what it's going to do, it's going to allow me to bend forward in terms of a contraction, and then stand up straight in terms of the opposite. And with that is the antagonistic pair of your rectus abdominis. What we've got is our Erector Spinae, which is going to work the opposite to that rectus abdominis. It's going to originate in the sacrum and ilium. So your ilium within the back part of our pelvis, and the sacrum within the smaller part and the lower part of our spinal cord. Its insertion point is going to be the upper part of the back of our ribs, along with some of the vertebrae through our lumbar. And what that does, it's going to allow the rotation of your spine and the bend at the lower lumbar and the sacrum. So finally, through our midline and our trunk, we have our external obliques, and that is the side point. So if we're really lean, what we'll see is the cuts that come through as a V, and it originates at the lower part of our ribs, and its insertion is the ilium, which is the inside part of our hips. And what that does, it allows contraction and lateral flexion. So me doing an oblique crunch or a side crunch. Within those obliques, you have internal obliques, almost like your pectoralis major and minor. The internal obliques sit within the inside of our external obliques, and it supports the stability of those muscles. Its origin is the ilium, and the insertion point is the lower ribs. And it does exactly the same as what our external oblique does in terms of allowing lateral flexion. So lateral being a side movement, and the flexion being the shortening of the muscle. Now if we move further down into our hips and our hip flexors, we have two major muscles that we think about. Now these muscles are probably the most prone for injury within our hip region, and that's our psoas major, which originates at the top part of our lumbar all the way down, and its insertion within the femur. So if we think about the way our hips move. It's going to move out and in, allow an opening the gate, close the gate, or kick. So if you're playing football, a lot of the injuries come from having weak hip flexors. The other muscles that support it as a secondary muscle is your iliaxis, which is originating in the lumbar, and the ilium, which joins the same again at the upper region of your femur. Moving on, we look at our gluteals and our adductors. So our abductors sit within our glutes, and our glutes are broken up into 3 different muscles. We have our gluteus maximus, gluteus medius, and our gluteus minimus. So minimus being the smallest, medius being the medium-sized muscle, and maximus being the largest part of that gluteus and the gluteals. And they originate at the ilium, which is within the hips at the top part of the back, wraps around the bone, and then attaches to the sacrum, which is the lower end of our spinal column or our coccyx. Okay, the insertion point of that runs all the way down to the top part of our femur, and when you contract it, it aids the flexion and extension of your quads and your hamstrings. Okay, so joint moves and joint actions that it allows, extends and outwardly rotates to allow hips to move up and down, and for you to kick a football or any other ball at that time. Our adductors, so adductors being what's closing, abductors is what's opening, so the muscles that allow our hips to move in terms of either close the gates or passing a side football or anything like that, is the 3 muscles in terms of our adductors, and they all originate within the pubis and the ischium in the lower internal parts of our pelvis. This insertion point is also the femur, but it's slightly, each one goes down, it's attached to a different part of the femur to allow proper spread within that femur, so there's all the bone getting contracted at the same time. So our hamstrings, one of the major muscles in our lower body, are broken down into 3 muscles: semitendinosus, semimembranosus, and biceps femoris. They originate in the ischium, and their insertion point is the tibia and the fibula. Actions that allow is knee flexion and hip extension to move the back of your leg. Its antagonistic pair is your quadricep, and in the wording of a quadricep, it's 4 muscles, which are broken down in your rectus femoris, vastus intermedius, vastus medialis, and your vastus lateralis, all given names because they are where they're located. So if we pinpoint the vastus lateralis, it's going to be on the outer side, the most lateral section. Medialis sounds like in the middle, so it's the most midpoint of that muscle, and the intermedius is the inner section of the medius, so the most medium part, which is actually on the internal part of our leg. And it originates in the femur and the ilium. Its insertion point is the tibia via the patellar tendon though, so it runs across that knee joint. The quadricep contracts all 4 muscles, and it allows flexion and extension, adduction and rotation. So even moving further down the body, our gastrocnemius, which is the calf muscle, it's broken down into one muscle, but it's got 2 heads. It originates in the femur, insertion point in the calcaneus, which is the back of the heel in terms of the bone. That joint crosses the ankle and the knee in terms of where it inserts and originates from, and it allows plantar flexion and dorsiflexion as an antagonistic pair with your tibialis anterior. Your soleus is that muscle that lies just above your gastrocnemius, and it originates your fibula and your tibia. They work together as part of the calf, and it allows plantar flexion, almost like a heel raise. And moving down around the leg, we have our tibialis anterior. So our tibialis anterior is the front anterior section of our calf. It's an antagonistic pair with your gastrocnemius, so it's going to do the opposite of the movement. It originates in the tibia, and insertion point is the first metatarsal, which is the inner point of the toe, so your big toe. And that allows dorsiflexion, as if we can remember, is the opposite to plantar flexion. So dorsiflexion pointing up, plantar flexion pointing down. So our last muscle is the pelvic floor muscles. And these are vitally important within pregnancy and giving birth. And they're situated under the pelvis. So if you think of the pelvis being that box on the hips, the inner point just underneath the sacrum of the spine and the coccyx. It's a double layered muscle consisting of a deep tissue and a superficial layer of muscle. And what happens is that provides support and stability for the pelvic girdle and controls the organs when you're growing a fetus in terms of pregnancy. What happens when you give birth is those pelvic floor muscles expand and allow the hips to open. Those muscles also control continence in terms of bladder control as well. Okay, so looking through the heart, so our cardiac muscle that we spoke about before, we're going to go through the diagram in terms of what we look at within the heart and the circulation of blood from a deoxygenated way to it becoming oxygenated and then going around to our muscles. So when blood is going around the body, it gets transported to the working muscles where it's used, and the oxygen is then used as an energy source, as aerobic and endurance and stuff like that use. When it enters the heart, it goes into the right atrium, passes through that right atrium into the right ventricle. This is still at a deoxygenated path. It goes into the pulmonary artery where it's pumped into the lungs. When it's in the lungs, if we can see, it goes into the left and to the right. There's two pathways for that pulmonary artery. It will pick up oxygen, come back into the heart to the left ventricle where it will be then pumped back out through the aorta to the working muscles back round that circulation. So if we look at blood itself, it is red. The consistency of it is going to change as it picks up that oxygen to allow to go through to those working muscles. If we look at where the actual heart is placed, it's going to be not so far right, but in terms of the size of our fist, it's going to be almost down the centre of our nipple. So if we follow the nipple into the centre chest, that's basically where your heart is placed for the anatomy of it. So from the heart, when blood picks up oxygen, gets pumped through that heart, out the aorta into the rest of the body, it gets travelled away from that heart in arteries. Now, a key thing to remember about arteries is A. A stands for away, so it means it's going away from your heart. Now, when it's going away from your heart, it means it's picked up that oxygen already, and it's going to get transported or circulated to the muscles and the organs of where it needs to go. Okay, dealing with high pressure blood, so what we're going to talk about is vasodilation and vasoconstriction. So vasodilation is when those blood vessels get larger to allow more blood volume to go through, but vasoconstriction allows the pressure to build up, our blood pressure, so that the blood can then get transported at a quicker rate to where it needs to go once it's got that oxygen. Within those red blood cells in that blood, though, there's going to be transporting those vitamins and minerals that our working muscles and our organs actually need to work correctly, to regulate hormones, to regulate the temperature and how the body works in terms of delivering an energy source to where it needs to go. So if you look at veins, veins are the opposite of an artery. Now veins, if we look at the words, V in, it means it's going in to the heart. So with the anatomy of a lot of these words, break it down into what you actually see instead of trying to work it out. V in, so V into the heart. Veins carry deoxygenated blood. So if we think about the circulation around our body, it's going out of the heart, away from the heart in the arteries, to the working muscles and the organs, and then in through the heart, through the veins. Now veins have a lot less pressure in them. It's got to climb up the body again to the heart to get that oxygen back in to do another circulatory path. Okay, our last circulational topic is capillaries. So capillaries are very small, one cell thick circulational pipes. What they do is they allow gaseous exchange. So capillaries are within your arteries and your veins, and they lead to allow oxygen and minerals and vitamins and all that red blood cells to pass through into the working muscles or into the organs. So if you think about how the arteries are connected to your muscles, say if you think about the veins and the arteries that you can see on your hands and arms, how does that blood go from those tubes into the muscles? Now that is how your capillaries work, and that's what their use is for. They allow the passage of that blood into where it needs to go.